The following is a special presentation of 11 Alive News and Untold Atlanta with Matt Pearl.
I don't want to be here. Honestly, I don't want to talk to you at all. I am 33 years old. This is the first time I've ever filed for unemployment. Ever had to get on state Medicaid. Yeah. It's fun stuff. Georgia used to be so loving. We used to be so happy here. Everybody is so aggressive. Everybody's eyebrows are like this. When you're worried or you're alone or afraid, you might not can breathe. The thing that brought me to Alpharetta was just a peace of mind. It's a good place for kids to run amok. I'm Danessa. I'm a single mom of 3. Aiden, Khalees, and Carmen. I would usually drop them off, and I would keep going to work. And my job was from 8 to 3. It took me forever to find this position, just being a mommy and single. My eviction notice, my 12-year-old, when they stuck it on the door, he was in the living room and brought it to me. You start looking at all your essentials and things like that. And sometimes rent isn't an essential, I hate to say it. I need it. I need my place to stay, but my kids need food and hot water and different things like that more right now.
My name is Doug Hooker. I'm Executive Director for the Atlanta Regional Commission. Last year alone, we had 150,000 eviction filings. In a good economy, in a quote-unquote normal year, our estimate is as many as 40% of regional households could be under threat of eviction if nothing is done. This is very widespread. A lot of people don't realize they see a lot of apartments downtown and midtown. The predominant number of affordable units are actually out in suburban communities.
It's not stopping me from having to pay my rent. I'm still under contract with my landlord. Even when December 31st comes, then what? So now I have a mounting debt, no foreseeable job, 3 kids. It's scary.
And the worst thing that can happen is that we ignore this problem, wait for somebody else to come and solve it, find out the cavalry's not coming right away, or if at all, and then we have thousands and tens of thousands of people who might have been helped wandering the streets. I think what worries me the most is that even if the community harnesses a lot of philanthropic support, the most that we can do is still a finger in the dike.
I have to show strength to them in the time of worrying. I have to let them know that everything is going to be okay, even though in my mind I'm not sure. Right now, I can't breathe. Right now, I'm sorry. Right now, my main focus is to keep the kids happy and safe.
Come into Dalton and you really don't see anything more than any other suburban town. But then you go to across the railroad tracks and you start seeing a lot of the taquerias, handwritten signs, colored signs. I'm in the heart of the Hispanic community. I would think that that's everybody's dream, to belong to a community that you care about and a family that you love. My name is Dora Price. Here is a good picture too. My family and I moved to Dalton in May of 1979. My mother was diagnosed with congestive heart failure the end of June. She just started getting worse and worse and worse. Family, friends were there to say their farewells, eating together around the table, talking, and doing what we weren't supposed to do. You know, we defied the recommendations of COVID protection. 19 of us ended up getting infected. My little brother Julio, she's gone and he's barely here.
Most of our families are considered essential workers. They lost jobs in hotels, in cleaning, maybe in agriculture.
This is the carpet capital of the world. Sometimes they are working 7 days a week nonstop, 8, 10, 12-hour shifts. And if the demand for the product is there, they have to do that.
There is a disconnect and distrust with our healthcare system here. When you go to the health department and they have to pass the jail, our community has been attacked in a very negative way. They are the workforce of this community, and in spite of all of that, never been recognized for their contributions. The schools are open now. Many things they are trying to go back to normal, but we are trying to reinforce and remember that the virus is not going to go away. We need to take care of each other in order to go through this pandemic.
This is from my visit on Monday. I prayed before I went in and I said, Lord, help me bring healing and a little bit of joy to my brother. Just help me, use me. It is not easy. I wouldn't desire this on anybody. And I pray for all the COVID victims because there are many.
think that because we're in a smaller town that there's not anything to offer here, which that's not true. Cuthbert, to us, is just magical. The emergency room is right there, and here comes the ambulance. My name is Laura Wiggins. I'm from Cuthbert, Georgia. It was August 4th. I presented with issues. I just probably would have thought it away that, okay, I'm okay, it's something else, but it wasn't. I just had a heart attack, and had it not been for our emergency room, I probably would not be alive today.
COVID was the straw that broke the camel's back. We were losing staff at an alarming rate. Our nursing home had 55 out of 75 test positive. We had a period of time we had to put all of our hospital beds on the vert because we didn't have the staffing to operate the nursing home, the hospital, and the emergency room. Rural medicine is different than urban medicine. In a county with declining population, 6,700 people, and it takes $4.5 million a year to operate an emergency room. So the pandemic, and it will push you over the edge.
Fall is the closest one. It's about 40 miles by the time you travel in, across the line and then get into town. My name is Nikki Bryant. I own Adams Family Pharmacy 2 in Cuthbert, Georgia. They only had one pharmacy here. There's a lot of poverty, and the healthcare needs are really great because of that. By the time the ambulance leaves here and goes out to the patient's home in a remote area of the county and then has to transport the patient 50 miles to another facility, that time is going to be valuable to their life.
We have depended on them for so long. We've taken for granted that they're there, and to know that it's just gone. I think it leaves everybody scared.
I was raised in Richland, Georgia, and we lost our hospital about 10 years ago. Closing of that facility has devastated that community and the surrounding areas, much like will happen here. We don't have a Starbucks and we don't have a Target. It's very hard to attract providers to this community unless they're from here. The people here are so grateful for anything that you do to go above and beyond to take care of them.
100% worry about what might happen again. And I don't know what will happen. I do know that because of them, I'm sitting here with you today.
Ride through downtown and see the way the buildings look. When you go through some communities and you see people who don't really have a lot of hope because there are no jobs here, that's a sign that we've been forgotten about. My name is Adric Ingram. I was a member of the first class to graduate from this school building. We just kind of lived life and, went through school not knowing, not even having a inkling of a clue that it was different than other people across the nation. We have a state championship basketball team from last year. Luckily, they were able to play the game before everything closed with the pandemic.
New hotspot emerging between the metro area and Augusta. That's in Hancock County.
Hancock County has gotten a lot of attention over the last several days.
A mask ordinance now in effect in the city of Sparta and in Hancock County.
A lot of it has been contained to nursing homes. But then there's another part of it where people have sometimes driven themselves to the hospital and didn't return home. The emotional toll that it's taken on individuals and our community as a whole.
That is a nursing home issue, long-term care facility. I'm not sure which one it is, but that's the reason they look like they're a hot spot. I don't think it's a county-wide problem.
Has the governor been down?
There have been no public appearances.
Why do you think Governor Kemp hasn't come down here?
I think part of it is a large part of our voting base is Democrats. And, you know, poor black folks don't really catch his attention. COVID does create a situation, but there were so many situations leading up to this that should have, turned on a light for someone. The hospital was closed years ago. We only have 2 ambulances in our county. So, God forbid you're the third person that gets sick, because they had to travel to another county to take people and transport them to get health care. Without a vision, this is downtown. Broad Street is kind of what you get. The centerpiece of your county in a terrible state. It looks as if we don't care, although I know a lot of people do.
This bag has our dream inspiration quotes.
Well, I'm secretary of the Sparta Hancock Historic Preservation Commission, and I'm project manager of Dream Streets. In the 70s and 80s, this was a thriving downtown area. Every parking space was filled. That can happen again. When I look at this storefront, I don't see all the rust. I see that this could be a microbrewery. You've got a community that's aching for something to be able to spend their money on locally. It's got good bones, it's got wonderful people. It just needs a hand up, and it needs people to believe in it.
Sometimes it seems so massive that you don't know where to start. I think the first thing is to build hope.
You've got to dream first. You've got to have an idea. You've got to have a dream.